Actually, the patient with cardiac myxoma show a variety of autoimmune symptoms, including hypergammaglobulin, production of autoantibody such as anti-DNA and ANF, and increase in acute phase protein, suggesting that cardiac myxoma cell itself or the product of cardiac myxoma may be involved in such kind of autoimmune symptom. Actually, we showed that cardiac myxoma cells produce IL-6. This is the first suggested evidence as might be involved in autoimmune phenomena. More important finding came next. We found that a large amount of IL-6 is present in the synovial fluid patients with rheumatoid arthritis, suggesting involved IL-6 in rheumatoid arthritis for the first time. Anyway, this paper, of course, published with Professor Kishimoto, and also this is very important in collaboration with Professor Maini and Professor Feldman. I still remember at that time I visited them in London. Okay. Anyway, this is the first suggestion. I think maybe involved rheumatoid arthritis. As you know, the rheumatoid arthritis is a chronic polyarthritis characterized by an inflammation, synovitis, that involves the peripheral joint, typically in a synovial symmetrical fashion. And both the entry factors and envelope factors have been involved. However, the etiology has not been yet soon unknown. Of course, we are now known that many cytokines, in particular the IL-1, IL-6, TNF, critically involved. Anyway, this is a 20-year-old slide. That time, I think that because patients show with rheumatoid arthritis show variety of symptoms, including polyclonal plasmacytosis, the production of rheumatoid factors, and increase in agar-positive IgG, and increase in acute phase protein, or even increase in the bone resorption activity to destroy joint, or increase in platelets. No? Just look these phenomena. Nobody can expect these different phenomena that do not apparently relate to each other. However, if one considers the multifunctional activity of interleukins, or even IL-1 or TNF, it could be interpreted. The cause which induces arthritis may be very intimately close to the cause which induces dysregulation of IL-6 gene or IL-1 material alpha gene, or induce abnormality of synapse construction through these cytokines. This led me to speculate. Yes. Then around that time, I was appointed as a professor of Osaka University Medical School almost 20 years ago. Then in early 1990s, I proposed a working hypothesis of possible mechanism involved in certain autoimmune disease and also the chronic inflammatory proliferative disease, CIPD, like rheumatoid arthritis, where IL-6 and IL-1 TNF form are considered to play an important role. In my hypothesis, maybe that activation of several sets of transfer factors, including N-kappa is a major central phenomenon which is involved in the initiation, governance, and progression of the disease. Initially, maybe several virus infection or bacterial infection, or even injury, or even the stimulation with foreign bodies like Pristin, which could induce inflammation in the locally. Then such locally induced inflammation turn on several activation transfer factors, including N-kappa, then resulting in the activation of several genes, including interleukin 6 and other cytokines, of course, TNF, so on, IL-1, and MHC class molecule or other hedgehog molecule or antibodies, so on. This event finally induced activation of immune system. So therefore, my hypothesis suggests the interaction between non-immune system and the immune system interactive ischiatus plays important role in autoimmune disease or chronic inflammatory proliferative disease. Then, in order to understand the mechanism, how the IL-6 induce a variety of bulk activity, we investigate signal transduction through interleukin-6 receptor. In summary, in this slide, IL-6 generates two major signal transduction pathways. One is the YXQ motif of GP130 dependent structural activation. The other one is the 759 tyrosine residue of GP130 dependent SHIP2 gap MAP kinase mediated signal transduction pathway. These two major signal transduction pathways variably involved in IL-6-induced cell growth, cell differentiation, cell survival, even in cell movement. Then, this is very important. To clarify in vivo, not in vitro, in vivo role of each of signal transduction pathway, we made mutant mouse, that's a knocking mouse, expressing mutated GP130, defective either YXQ dependent STAT3 signaling or 759 tyrosine dependent SHIP2 mediated signaling factor pathway. For this, we replace the exon encoding the cytoplasmic domain of GP130 with a cDNA, and where we introduce a point mutation. For example, tyrosine 759 was replaced with phenylalanine, or we replace all tyrosine residue, tyrosine required for the STAT3 activation, replaced with phenylalanine. So by this way, we made a series of knocking mouse expressing a mutant GP130. Among them, F759 mice, where tyrosine 759 was replaced with phenylalanine. These F759 mice showed enhanced STAT3 activity through GP130 because, as you know, 759 tyrosine is required for SOP3 or SHIP2 mediated stop signal. And in this case, this stop signal is defective, therefore STAT3 is enhanced, specifically enhanced through GP130. And the most intriguing, very important finding was that this F759 mouse spontaneous, no immunization, no complement treatment, spontaneously developed rheumatoid arthritis-like disease as age. So this is the first definitive evidence showing that IL-6 or IL-6 signaling is critically involved in spontaneous autoimmune, not artificial, spontaneous autoimmune disease like rheumatoid arthritis.